everyone, and welcome to Women's Health Tech Wednesdays. I am your host, Nina Joshi, and I am very excited about today's guest. Before we bring her on, just wanted to run through a couple of quick announcements for everyone. We do have our Breakthrough Innovators Challenge applications live, so if you are interested, please be sure to check that out. We also have our April Symposium on April 27th coming up fast. All of the registration information will be in the chat for that. And then we also have the Breakthrough Board application. So if you are interested in joining, scan the QR code or head to the chat to see the link for that as well. And so with that, we'd like to bring on our guest today, Jessica Lake, who is the Chief Science Officer at Limbix. As you know, we love questions here at Women's Health Tech Wednesdays. So if you have any for Jessica during the conversation, please add them to the Q&A feature or the chat feature, and I will make sure that we get to it. So with that, we'd like to formally bring on our guest, Jessica. Thanks so much for being here.
Thanks for having me, Nina.
Yeah. Well, would love maybe to kind of kick things off. If you could tell us a little bit more about yourself, your background, and kind of the journey that has led you to Limbix.
Yeah, absolutely. So you can call me Jess too if you'd like, but
Okay.
I'm Jess Lake. I'm the Chief Science Officer at Limbix. At Limbix, we develop digital therapeutics for adolescent mental health disorders. And so my journey was one starting in an interest in the brain and psychology. So I started an undergraduate major in neuroscience and behavioral biology. I went to get my PhD in psychology and neuroscience. And from there was really sort of taking these steps towards understanding how the brain and things that we know about psychology and human behavior have impact in psychopathology and ultimately in the real world. So I did a postdoc after my time in my graduate program, looking at basically how the brain and emotion interact to influence the way that we think and how that's influenced by psychopathology. So I was working in a clinical psychology lab, really looking at schizophrenia, also anxiety and depression. And I was on originally a real traditional academic track. You know, I was doing my graduate degree, a postdoc, and then really looking towards, that next step of moving into a professorship. Ultimately, though, I felt like I wanted the work that I was doing to have more of a real world impact. And I looked around at the opportunities there and, wanted something that not just leveraged the skill set that I had developed as an academic and as a PhD, but really as well the subject matter domain that I had spent years at that point developing and cultivating. And that's when I discovered this world of digital health, and specifically this piece of digital health called digital therapeutics, which are products that are meant to prevent, treat, or manage disease. And it really felt like a great way within the mental health space to take the work that I had done focusing on human behavior and focusing on psychopathology and being able to take that sort of subject matter expertise and apply it into a real world context and leverage that research background I had developed as well to really help people and create products that could have impact at scale in the real world.
Absolutely. That's amazing. It seems like it was so purpose driven your entire career, which I think is so incredible. Would love if you could share a little bit more about your specific role at Limbix. What is the mission? What is the vision of Limbix? Would love if you could kind of immerse us in this great company.
Yeah, absolutely. So, as I mentioned, at Limbix, we're developing these products called digital therapeutics. So these are products, as I said, that are meant to treat, prevent, or manage disease. And when you're looking to make products of that nature, those are products that are actually regulated by the FDA or regulated by regulatory bodies in the US. That's the FDA. So they're treated as medical devices. And so what that means is you have to go through the FDA regulatory process to have those products cleared. And so in our case, we're going through that process right now with our first app for adolescent depression, and we're developing one as well for adolescent anxiety. And so my role has shifted somewhat over time, I think, as is natural at small scale startups. But I'm intimately involved on the research, the clinical research side, so actually demonstrating the safety and efficacy of our products. But also, I think just as important is really thinking about how science and research are leveraged in the development of these products as well. And so my team is the science team that's a little bit more of the applied arm of research. And so I manage and oversee a group of individuals who are clinical psychologists, data analysts, user research teams that are really embedded and working really closely with the product team to ensure that the products that we create are evidence-based, so leveraging that research background of our clinical psychologists, as well as their clinical experience working with these patient populations to ensure that we're building products that are evidence-based. And then having that sort of feedback loop to say, how are we leveraging the data that we collect to inform our product development process? And so that's where our user research and data analytics teams come in as well.
Wow, I love how it's like they're multidisciplinary, but they're kind of also important, touching what the patients or the members will see. So I think that is absolutely amazing. And I'm just so curious because I know you've kind of come from a background in academia, now kind of working in this startup kind of landscape. Does that feel like for you? What is it like kind of working in a startup? And would also love if you could share kind of the evolution of a startup since kind of the beginning stages to where you guys are right now.
Yeah, absolutely. So, I think in a lot of respects, I felt like when I joined Limbix and working at a startup felt a lot to me actually like working in a lab in some respects, at least in
Oh,
terms
wow.
of the work that I was doing initially, which felt a lot like setting up a research lab when I was specifically when I first started, I was our director of research. And so I was focused on sort of building out the competency of us to run research internally, as well as to work with external collaborators to develop research programs as well. And so a lot of that felt similar to building a lab. And I think also just working at a startup, coming from an academic, traditional background, and working in a research lab, you're working in both contexts in a place where no one has really solved the problems that you're looking to answer, right? So it's all about generating new knowledge and creating your own answers. So I think coming from that academic background, I feel like it prepared me actually really well to work in a startup because I had to sort of trust my own instincts and be able to sort of work through problem solving in a way that I think a PhD and my academic training really prepared me for.
Wow, that's amazing. And like, are there any differences when you think about, for anyone that is interested in, maybe kind of entering into the startup landscape or joining a startup, were there any differences kind of working in a smaller company versus a larger company? I would imagine that there's a lot of really interesting differences or juxtapositions between the two.
Yeah, totally. So when I started at Limbix, I was maybe hire 8 or 9
Wow.
at the company, so really small. And so even in the time, we're about 50 people now, and so to me that's big. But
That
in the
is,
context of
yeah.
companies that exist, still small. But even in that sort of difference between then and now, what our company looks like, what it feels like to work at our company looks very different. And so, and I'll say that, this is my personal experience. Some of it I think resonates, but I think a lot of what it feels like to work at a small startup really depends when they're, 10 people, it really matters who those people are and, what their values are and what, the co-founders of a company, it really matters what's important to them and how they sort of structure the company. So I feel really privileged to work with a group of individuals who share a lot of the values that I have, especially working in the mental health space. Work-life balance was something that was really prioritized, especially early on, which I think is pretty unusual for small scale startups where you have to be scrappy. And that was still true for us where, you wear a lot of different hats. And I think you have to be comfortable with your role. It's hard because you don't have someone necessarily internally to turn to tell you how to do your job. There isn't sort of, multiple people with the same
Playbook.
job title. Yeah, exactly. You're building the playbook. So if you don't have any support internally for your function, you need to feel comfortable looking externally for that. I'd say as we've moved and developed as a company now, I may not wear quite as many hats as I used to. We now have people who I'd say that the hat fits better on their heads, right? Where they really are specialized in certain areas, and that's been great. It's a transition period that you go through sort of to let go of certain things and really focus a little bit more. But it leads you to get a little bit deeper. And I feel like as we've sort of grown into more of like a adult company or like what feels like a real company with some structure and organization, it's shifted the nature of the work that I do. But now there are teams of people who can work on these products, we are building and iterating on that playbook that we were developing. So it looks very different, and I think it just depends on your background and the experience that you bring, and what you're looking for in terms of mentorship and things like that, where sort of the right place is in the development of a startup specifically, or what you're looking for in a company in general based on the size.
Yeah, no, that makes a lot of sense. And it's like being so kind of one of the earlier hires, I think it is also really interesting and pretty amazing that you also kind of get to really, it seems like, help set the culture and like some of the value systems. So I think being able to co-create a lot of that based off of people that also have like values, I think is a really great opportunity. So that sounds really exciting.
Yeah, absolutely. And I think that is another benefit of working in a small company is because there are only a few people who are there. Who those people are really matters in terms of the trajectory of the company. So the ability to have impact, I think, is not necessarily greater. It's just different, but the sort of scope of the impact you could have, I think, probably is greater in some respects working at a small startup, because each individual person's experience and perspective really helps shape the company and helps shapes what it is you're working towards as well.
Apps 100%. I would also kind of really love to pick your brain about kind of the product development side, kind of on that note about just being able to have people that, have all of these different expertises and kind of coalescing this group to really be able to help with that. Would love if you could share a bit more about, what is your approach to product development and kind of how do you bring science and some of those aspects from academia into the product development philosophy or life cycle?
Yeah, absolutely. And this is something that I feel really passionate about. And I'm really proud of what we've built at Limbix, because we don't have our science in a silo from our product development. We really, as I mentioned before, have our science team embedded, working side by side with other members of the product team. And so, focusing on our clinical science team, we have those folks sitting with our designers and our content designers as well to really set out our clinical requirements. Basically, what is it that is necessary to build evidence-based products, and what are the clinical requirements that are needed to be included in this product for it to be effective for our patient population. And this isn't just a direct translation from, we work on cognitive behavioral therapy products. So this isn't just, take something that works in face-to-face therapy and build it in a digital format, but really, translating that and making sure that we give the product teams the freedom to have creative solutions, but ensuring that we still keep those evidence-based, clinically driven requirements as part of that. And so that's the role that the clinical scientists play. And another thing I think that's a big value of what we do at Limbix is not just building a product and then saying this is good enough and that's it, but right, like we're constantly looking to iterate and continue our development, always with the aim of improving outcomes. And so that can mean different things, but when we talk about, for example, engagement with our products, we're not looking just to increase screen time for use of the product, but we're really looking to increase and leverage an understanding of meaningful engagement with our products, ultimately to drive improved outcomes. And so I think we've thought really thoughtfully about this and brought in user research, data analytics to really ensure we have that feedback cycle where we're constantly improving our products, making them hopefully more tailored for different patient populations as well, and not sort of treating adolescents, with depression for our product as a single monolithic group, but really looking to leverage insights that we collect to improve the product over time.
That's absolutely incredible. And so for this particular product that I think you're first developing, which is the depression in adolescents, so are you kind of in the clinical trial phase for that right now, or is it pre-clinical trial?
Yeah, so we're in a little bit of an interesting situation. We just completed data collection for the clinical trial that we would intend to submit to the FDA as part of our clearance process. So that's really exciting.
Very exciting.
The sort of weird place that we're in right now is because of the COVID-19 pandemic, there were sort of some restrictions or regulations that were relaxed a little bit for products like ours. So under an enforcement discretion policy that the FDA released during COVID, we actually were able to go to market early. So our product has actually been in market since October 2021 under this
Oh,
enforcement discretion policy. We've been offering it for free for patients pre-clearance. And so that's been an amazing opportunity too in the context of product development to get this real world feedback
absolutely.
too outside of clinical trials. But so yes and yes is the answer to the question of we're moving through the clinical trials process while also leveraging real world and having real world commercialization impact.
That's amazing. And I'm so curious, like, if you have any particular insights, just I think being able to have something on the market, see how people are actually interacting with it, kind of in the greater context of their day-to-day habits and their life. Was there kind of anything that was surprising to you kind of as you're getting feedback, or was it kind of on par with what you would kind of, the assumptions that you had gathered from this, the pre-feedback and research that you've done when developing the product?
Yeah, what I'd say is I'm not sure that there's anything that's been incredibly surprising, but what we expected and then did see is, when you're looking at engagement with products in the context of clinical research, you see much higher engagement than you do in sort of real world contexts. And so that just, you have the support of research staff and, just the fact that you're in a study and maybe you're getting compensated for participating in that study as well. Whereas in the real world, there are lots of different factors that impact and sort of draw attention away from this product, right? And so I think that's something that we saw, and but sort of seeing that that drop off pattern has been really insightful for us and driven us to sort of understand better where the places are that we want to focus our attention to really drive that impact and engagement in the real world.
Absolutely. And kind of with your product being out on the market right now, is it something that anyone can just download? Is there a partnership where it's kind of prescribed or a physician recommends it? Like, how are folks kind of learning more about Limbix and the work that you do and what the product is?
Yeah, so right now the product is offered through a licensed healthcare provider.
Okay.
So this will ultimately be a product that is offered through a licensed healthcare provider. So we have a website, it's sparkrx.com. And so folks can learn about it there. There's information that if a patient is interested, they can bring that to their provider, but ultimately there's an access code that's gated through a healthcare provider.
Love that. Also wanted to ask you because, clinical trial and being able to be kind of at that level and or where you are is definitely very, very exciting. And so also kind of really curious, this is kind of a phase where there's so much great activity that's happening and you're growing the company. What has been like an influential moment or a big milestone for you when it comes to just the work that Limbix is doing?
On the clinical research side, I mean, I would say that the biggest milestone is one that we just passed in completing this clinical
Mm,
trial for being able to submit for clearance. And the data that we collected there is not something I could speak about publicly yet, and we're still sort of in the analysis process. But this was like a monumental, huge effort from our team. We actually ran the study entirely internally. So it was our research team doing the recruitment and along with other
wow.
folks across the different teams at our company. And so it was really a huge team effort to recruit for this trial, run the trial, analyze the data. And so it's been a really exciting project to undertake, and again, like a huge team effort that we're really excited is sort of reaching the conclusion right now.
Absolutely. That is so exciting. And also congratulations. Just to
Thank
be
you.
able to get to this point, I know is there was a lot of hours behind it. I can only imagine.
Absolutely, yeah, a lot of time spent by those teams.
That's amazing. Also, I'm so curious, just given your expertise and really the experience that you have kind of working in all of these different angles that has kind of led you to here. I think when we think about digital therapeutics, then mental health kind of is a very popular use case. And I think a lot of it is because we think about, these common access issues that digital therapeutics can help alleviate, or we think about,
Mhm.
maybe some of the stigma around mental health where technology can kind of help with some of that as well. Would love if you could share a little bit more. I think even just broader, what are, some of the benefits or some of the things that you're thinking about when it comes to the role that digital therapeutics can play when it comes to mental health. And I'm very curious too, kind of, especially kind of with adolescents.
Yeah, you really hit the nail on the head in terms of where we see the value of digital therapeutics coming is that access to care piece. And So, we know that adolescents, the majority of adolescents who are suffering from behavioral health issues don't receive treatment. So it's something like around
Mhm.
60% of adolescents
Oh,
with
wow.
depression, yeah, don't receive treatment for their symptoms. And there are lots of things that play into that barrier that we see. So, there's stigma, logistical issues, and getting to face-to-face therapy, but there are incredibly long wait lists to see mental health specialists. So 3, 6, 12-month wait lists, depending on the locations, right? And not to mention that there are just different geographical issues too in terms of, access to mental health providers. And so we really did see this product as, and digital therapeutics more generally, as a way to increase access to effective care. And the idea of these being FDA regulated product speaks to the clinical efficacy behind it. We actually will have the data to back up claims of in terms of the efficacy and safety of this product. And so, we see it being sort of fitting into a full stepped care model where this could be something that's offered by a primary care provider who, does an annual screening visit with a patient and sees that their behavioral health needs and in conjunction with a referral maybe to a mental health specialist, they can offer this product. So it's something that a patient can download and do right now, or and hopefully that's all that a patient needs to resolve symptoms. But if not, it can totally be something that's adjunct to outpatient psychotherapy with a mental health care provider, where between sessions the patient has something that they can be working on and in conjunction with medication as well. So we really see it fitting into that full care, stepped care model, but really increasing access to effective mental health care and doing that at scale.
Right. That's amazing. And I know, the product that you have right now is kind of primarily targeting adolescents. Is that kind of a population that you're kind of really interested in focusing in on, or are you going to expand to other populations as well?
We're really focused on that adolescent age group, and we saw it as just an area that people weren't paying as much attention to in this space, and an area of great need, right? If you look at the statistics, and you really can't turn on the news these days without seeing that we're facing a crisis for adolescent mental health. If you can treat those symptoms earlier too, you look to have long-term impact. And so, treating the symptoms early, I think, is really impactful. And we just see it as a population of great need. And it's also a population that's really receptive and comfortable with technology. So it also makes them sort of a willing participant too. It removes some of the stigma of mental health, which, to be fair, that younger generation is, I think, the model for embracing talking about mental health. But for those who may feel less comfortable with speaking of mental illness and talking to a provider, maybe this is something that they can do in more of a discreet manner, but a receptive audience to technology as a solution.
Absolutely. No, and I love that's kind of the focus, kind of making something that's really tailored to the specific group and what their needs, wants, priorities are kind of in a tool like this. We actually have a question from the audience. So I want to make sure that we get to it. So the question says, in reference to the drop-off point just mentioned, is there a plan to also include a virtual one-on-one coaching with the therapist to augment care and ensure adherence with therapy?
Yeah, so right now our products are fully self-guided, so there isn't that necessarily immediate plan to integrate that with the product itself. But I think what I was just speaking to before in terms of fitting into a stepped care model, our product is very well positioned to be combined with other levels of care or other types of providers or services. So I think that's a really good point that in addition to being sort of adjunct to psychotherapy, this could be combined with coaching really easily. And we're really interested in different types of partnerships with other companies as well, or other sort of groups that I think this product can fit really well alongside that as well.
That's amazing. And on that note, I'm also very curious, is there any kind of, physician clinician dashboard view or some kind of relationship where they can see maybe, milestones, progress points, anything like that with the app?
Yeah, there absolutely is. So we've developed a provider dashboard essentially that shows providers patient symptoms over time. So weekly symptom checks that are completed in the app by the patient, that is surfaced to providers so they can see and track their patients' symptoms over time, as well as different measures of engagement. So providers can understand how their patient is engaging with the product. And, we're working on some features too to allow a little bit more interactivity where providers can provide encouragement and nudges to help folks engage with the product. And when we know from research that that sort of human support is really impactful for driving engagement with these sorts of digital self-guided tools. So we see the provider as a participant in that process to really leverage that relationship to improve engagement with the product as well.
That's amazing. I mean, already I can just see that there is so much insight that you have kind of gathered, your team has gathered when it comes to really the role that digital therapeutics and specifically Limbix can play. Would love it just to get your thoughts on, I mean, I could imagine that in any kind of startup landscape where you're building something new, that there's definitely challenges and hurdles for anyone that is kind of in the startup landscape themselves or interested in kind of being a part of that landscape. Would love if you could share maybe some like the early days when it comes to maybe some challenges or hurdles and how you kind of solved those as you've moved forward.
Yeah, I think there are some challenges that we faced along the way and that we have solved, and some, to be honest, that we haven't yet. I mean, I think a big thing in a startup context is to not be afraid of making changes. So for example, a really big change that we made a number of years ago is Limbix actually started out as a VR company. We were building virtual reality for mental health disorders, like, exposure therapy content in virtual reality. And there was a ton of research to support that process and that type of product. Ultimately, though, we looked around and didn't feel like we were solving a top problem for the patients that we were looking to serve. The biggest problem that we saw was this access to care issue. And the product that we were building was really meant to be a tool for clinicians. But we were seeing that a lot of patients weren't able to even make it into a clinician's office. And so I think we made that switch. And I think working at a small startup, you have to be sort of open to shifting with the market and external factors outside of what you're doing, and really listening to folks in terms of the impact that you can have. I'd say there's still some barriers and challenges to what we're doing these days in terms of like commercialization, finding that right business model that a lot of others in the space have struggled with. And, we're really looking to try to find a resolution to that as well. But there are always challenges, I think, in the startup process that something new to tackle.
Yeah, but I think that's just great life advice, I would say, in general, of just really being able to, give yourself the flexibility and the grace to be able to just change. And if things aren't, if you're seeing that it's not working in a specific context, that it's never too late to kind of shift gears or to pivot. So that's just great life advice, I think.
Yes, I think so too. Yeah.
I love that. And I also just realized that we are at time. This conversation just flew by. I am so excited to see kind of what Limbix is up to. We definitely should do a part 2 kind of in a couple months, because I already know there's going to be so much really exciting insights that you can kind of bring from this next phase of the product. But really wanted to thank you for taking the time to chat with us today, Jess. It was such an amazing conversation.
Yeah, thanks so much. It was really fun getting a chance to chat about Limbix.
Absolutely. I also wanted to thank our sponsors for sponsoring this conversation. I also wanted to let you know to join us next time for our next amazing chat. And one last huge shout out to Jess for a really amazing discussion today. If you are interested in learning more about her or Limbix, her LinkedIn information is also in the chat. And with that, I'll see you all next Wednesday. Bye, everyone.